Welcome back to the Mexicali Bariatric Center YouTube channel. Today I would like to talk to you about what it is that we do to help prevent blood clots at the time of a weight loss surgery. We start way before a patient gets here. We send them a couple of medical forms to make sure they're a good candidate for surgery, and the doctor will give them specific pre-op instructions. Sometimes we find that patients have a history of blood clots, or they're taking some certain medications like Plavix, or they're already on blood thinners like warfarin and Coumadin, and we'll give you specific pre-op instructions for that. They do need to be suspended, and we substitute it for something that's also a blood thinner that is unsafe to use at the time of surgery. So we'll give you instructions on that. But regardless of this, for every patient that comes in, we do blood work to make sure coagulation levels are fine, and the doctors know what the quality of the blood is when they come in. And again, they might get specific instructions for that. The day of surgery, we start patients on a high-quality blood thinner that's safe to use during surgery, and we also start patients on breathing exercises. The breathing exercises are mainly to prevent any pulmonary problems, any lung problems, but it also keeps the blood well with adequate levels of high oxygen. Okay, that's also very important. At the time of surgery, we place on the patient's legs the pneumatic compression stockings. These are the ones that keep the legs pumping blood and circulating at the time of surgery. You have this while you're under anesthesia at the time of surgery, and while you're also in recovery, which is about 2 or 3 hours after surgery. Then you go to your room. While you're in your room, as soon as you get to your room, we will ask you to start walking. Some patients don't like this very much, but they know it's a preventive measure, so everybody complies. We have the nurses ask you to get up and walking. And again, this is to keep the blood circulating, besides other benefits that it has, other aspects of surgery. And again, you continue with the breathing exercises. And another very important thing is that we need to keep you very well hydrated. This also helps prevent blood clots. You're on an IV the entire time you're at the hospital. Well, remove it the day before once you start your liquid diet, but the first 2 days you're on an IV. And we need to make sure that you're well hydrated. They measure the output of liquids from your body. So every time you go to the bathroom, this is the urine is measured and recorded, and the doctors are able to see if you need more or you need less, or if you're doing fine. And then finally, the day you go home, we will ask you to wear the compression stockings for your trip back. And basically, these are all, like I said, preventive measures. If you have any questions, if there's anything that you would like us to address, please feel free to leave a comment, and we hope to see you soon. Bye-bye.